Hello friends. Today we have Dr. KK Gupta with us. Hello, sir.
Hello, sir.
So we play tennis together. We are, tennis buddies. And Dr. Gupta had some baldness issue in the front. So how did you, decide to go for transplant surgery, Dr. Gupta?
At my age, I am a senior citizen, 62 years old.
But you are very young.
I am a senior child specialist practicing in Ashok Vihar. Just for fun sake, because many of our tennis friends got done hair transplant from Dr Shail Gupta, and their results are very good. So I think I should not try it. So I tried it, and I am seeing the result. It has been almost 1 year back. Now, results are fantastic. And the work done by Dr. Shail Gupta is excellent. The patient does not feel the pain, etc., any cumbersome, which excellent. And follow up guidance and what drug to be taken, what diet to be taken, and continue with the sports has given the excellent results.
I must say that your game has also improved. I think you feel more younger.
Yes.
When we play tennis together and I see Dr. Gupta's strokes, they have really improved. So thanks for having.
It makes the difference.
Yes, it makes the difference. You are young by heart. Age is just a number. So I think people like Dr. Gupta set an example for the society, the way they live their style, their life, the healthy kind of lifestyle. It's amazing. We learn a lot from Dr. Gupta. We have, in fact, he only taught me tennis, and he has been playing since so many years now. I think more than 2 decades. Yeah. So that's amazing. And in fact, I must say that the passion which he has for sports is amazing. Like, we did his surgery, and almost 6th day he was there on the court, and it was a rainy day, I still remember. And he was there, and I said okay, like I asked him to maybe wait for a few days, but his passion was so great. And in fact, Dr. Gupta is a very positive person, I must say, and he has a strong faith in me. So that is the thing which actually made a huge difference. And once I show you the results, you'll understand that. So positivity and faith is something which can really make a huge difference to your outcomes. So Dr. Gupta's case is interesting. Sir, what's your age?
62.
62. So he was 61 years of age when we operated him, and as you can see in his previous pictures, the donor area was limited, and there were huge gaps, like the frontal portion, middle and crown almost had very few hair left. So the obvious choice in such cases is a combination of FUT and FUE, which I obviously thought of doing for him. But the problem in his case was that the donor area at the back of head was very tight. So we had to do an FUE surgery for him. Obviously this would have been better, the number of grafts, the yield would have been better with a combination surgery. But yes, in some cases it is just not possible. So the important point is doctors should be expert in both the techniques, FUT and FUE. Only then he can provide a proper and most appropriate solution to his patients. So coming to the results, let me show you. Very important aspect of result is natural hairline. So if you see, it doesn't look like a transplant surgery at all. We did transplant in the frontal area here. We created small temples. Sir, if you could please show the temples, the sides like this here. We did a little bit of temple work on both the sides, as you can see here. And we had planted grafts till this portion only. And this area, if you see, this area has improved with medications and PRP. There was no graft, not even a single graft was put in this area. So now this again is a very important point which I would like to highlight. In a lot of cases, when patients have small, tiny, miniaturized hair, sometimes they respond very well to these treatments like the medicines and the procedure PRP which we did, and it happens in a lot of patients, and especially the ones who are very positive. So, but at times these results are being projected as plain transplant results, which could be very misleading as well. So you have to take care of this. I mean, when you are analyzing the results, when you are shortlisting your clinics, you must see that the pictures, as you can see, Dr. Gupta's pictures which we took pre-surgery, they were taken without shaving off his head. So whatever hair growth he had is clearly visible in those pictures. But sometimes if you shave off the head, then there are a huge number of small, tiny, miniaturized hair which you once shave off, it looks as if it is bald. But when these hair grow, or when these hair start responding to medications, it looks like a very dense growth. So sometimes a very ordinary looking transplant, ordinary transplant can look more than what it actually is. So this is something which I would really emphasize upon, and I would like you to also take care of this in future. Now if we just take a look at his donor area, that is also important, so I'll just show you. So if you take a look, we did 2000 grafts by FUE method. 2000 is a very small number for such a large area, and look at the hairline, it looks very natural. It doesn't look like a transplant at all. If somebody sees him, he won't be able to make out that this is a transplant. Look at the hairline, very nicely the grafts have been placed, and there is no obvious sharp demarcated hairline. It looks good. Since we had a big area to cover, so we were focusing on coverage. So with 2000 grafts we covered this much area, and because Dr. Gupta has little curly hair, so we knew that even if we place less density of hair in this area, we will be able to get a good coverage. So that is what exactly happened, as you can see here. And now, where we did not do any transplant, there was not even a single graft put in this area. Now if you see, look at these hair are the result of medications and PRP, which is quite good. If you look at the transition area, now this area becomes important because this area will respond way better. If you look at the pictures, before pictures, this area he didn't have hair. Now these are all regrown hair with medicine, so the size of the crown is reduced. So sometimes it's a good idea to get some medicines done, get a PRP session done, and just see how much potential your remaining miniaturized hair have to regrow. And take a look at the donor now. If we see, the donor area is like good, okay. We did not do over extraction, but yes, you can see small tiny scars of FUE extraction here. Now if we try to extract another FUE from the same area, it becomes difficult, because of scarring, the angles change. So we didn't do over extraction for him, so that this area remains okay covered. But yes, in some cases, if and he had good density, but everybody doesn't have that kind of density, and that is also very important. Sometimes patients, to begin with, like before transplant, they have less dense hair in the donor area than Dr. Gupta, where we have already extracted 2000 grafts. So one has to be very careful. If I show a combing video of Dr. Gupta or a patient who has good density, very good density, even after extraction you see this. which sometimes can be very misleading. Dr. Gupta's case, it was tight, so we didn't do FUT. It was very tight here, as you can see, very difficult to move. So, but in this case, in case we could have done, an FUT surgery, we easily could have got around 4,000 grafts. That kind of density he has. So density is always, the number of grafts which we get is always more in FA.
Because of so big experience of so many clinical experience, I can say, and Dr. Shail has a marvelous knowledge about transplant, beautiful skill of doing this transplant, and decent behavior. Communication is excellent. Patient does not feel he is at home. We need in today's time doctors like Dr. Shail Gupta. And number two, from patient side, he should have a positive thinking, he should have a willpower, he should have a good eating diet, especially for hair, fruits and vegetables. This is a must. Then your result will be excellent. Thank you.
Thank you very much, Dr. Gupta. Thank you very much. It was pleasure working for you, and we enjoy playing together.
Thank you.
Thank you. Love yourself. Stay blessed.